PCOS. What every woman needs to know. Meet Emily. She's 27 and goes about her daily life like every normal young woman would. But for years, she noticed something strange about her body. It started with irregular periods. Sometimes they would come late, sometimes they were heavy, and sometimes they didn't come at all. She had acne flare-ups, gained weight unexpectedly, and noticed hair growing in places she didn't expect. At first, Emily thought it was just stress, or maybe her body was different. But eventually, her periods stopped entirely, and for more than 6 years, she hasn't had a single cycle. She didn't know that what she was experiencing was Polycystic Ovary Syndrome, or PCOS, a condition that silently affects millions of women worldwide. When I was 24, I heard about PCOS for the first time. A few years down the line, about 3 years later, I began to notice some weird changes in my body. Irregular periods, weight gain, especially around my stomach, and acne. But instead of ignoring it, I quickly consulted my doctor. I was diagnosed with PCOS. It was not new to me because I had heard about it before. I was advised to change my eating habits, start exercising regularly, and follow my doctor's advice. Slowly, I started seeing my periods again and felt my energy levels improve. Both stories are real, and they show two sides of PCOS, one where it goes unnoticed for years, and one where early awareness makes a big difference. If you've ever felt like your body isn't behaving normally, this video is for you. Stay with me, because by the end, you'll know what to look out for and how to take action. Before we continue, don't forget to subscribe, like, share, and turn on notifications so you never miss our health insights. Now, what is PCOS? PCOS is a hormonal disorder that affects women of reproductive age. It happens when the balance of female hormones, estrogen and progesterone, is disrupted, and the body produces more male hormones, called androgens, than usual. This imbalance can affect your menstrual cycle, fertility, metabolism, and even your appearance. Who can PCOS affect? PCOS can affect any woman, regardless of age or size. It's more common if there's a family history of PCOS or diabetes. Being overweight, having insulin resistance, or low-grade inflammation can increase risk. But here's an important fact. Even slim women can have PCOS, so nobody is immune. Causes of PCOS. Doctors don't fully know the exact cause, but several factors play a role. Hormonal imbalance. High androgens disrupt ovulation. Insulin resistance. Your body struggles to use insulin properly, which raises androgen levels. Genetics. Family history can increase your risk. Inflammation. Low-grade inflammation can worsen hormone problems. Symptoms to watch out for. PCOS can show up in many ways, but common signs include irregular or missed periods, heavy menstrual bleeding, excess facial or body hair, acne or oily skin, unexplained weight gain, especially around the belly, hair thinning or hair loss on the scalp, dark patches on the skin, difficulty getting pregnant. Some women have only a few of these symptoms, while others experience many at once. Why PCOS is serious? PCOS isn't just about periods or appearance. If untreated, it can increase the risk of infertility, type 2 diabetes, heart disease and high blood pressure, obesity, sleep apnea, anxiety and depression. This is why early detection is key. How PCOS is diagnosed. Doctors usually diagnose PCOS using a combination of medical history, your menstrual cycle, weight changes, and symptoms. Physical exam, checking for excess hair, acne, or weight distribution. Blood tests, measuring hormone levels. Ultrasound, to check for cysts on the ovaries. Not all irregular periods mean PCOS, so professional evaluation is important. Managing PCOS. While PCOS has no permanent cure, symptoms can be managed effectively. Healthy diet. Focus on whole foods, low sugar, and high fiber. Exercise. Even 30 minutes a day improves insulin sensitivity. Weight management. losing just 5 to 10% of body weight can regulate cycles and improve fertility. Medication, birth control pills, anti-androgens, or insulin-sensitizing drugs may be prescribed. Fertility treatments. For women trying to conceive, options like ovulation induction exist. Lifestyle tips for PCOS. Daily habits make a difference. Eat fruits, vegetables, and whole grains. Avoid processed foods and sugary drinks. Exercise regularly. Walking, dancing, or yoga helps. Manage stress through mindfulness, meditation, or hobbies. Get adequate sleep. Track your periods to notice patterns. Even small changes can improve your hormones and overall health. Mental and emotional health. PCOS can affect confidence, self-esteem, and mental health. Excess hair, acne, weight changes, or infertility can make women feel anxious or depressed. It's important to seek support, talk to friends, or consult a therapist. Your mental health is just as important as your physical health. Real-life lessons. Remember Emily? Her PCOS went untreated for years and affected her physical and emotional health. Sophia, on the other hand, caught it early. She made lifestyle changes, worked with her doctor, and her periods returned. She felt more energetic and confident. PCOS doesn't have to control your life. With awareness, care, and lifestyle changes, women can live healthy, fulfilling lives. Take action. If you notice irregular periods, sudden weight changes, excess hair growth, or other symptoms, don't wait. Talk to your doctor, track your cycles, and make lifestyle adjustments. Subscribe to Bolvic Health. Like, share, and turn on notifications to get more trusted health information. Your health matters. Take action today. Bolvic Health, connecting you to better health.